Hi, I'm Dr. Sean Johnson. I'm a cardiothoracic surgeon, and I work at HCA Florida Healthcare, the Broward market. I was age 5 when I realized I wanted to be a surgeon. My parents always tell me I couldn't even pronounce the word surgeon, and eventually I became one, and, heart surgery became my love. The conditions and the procedures I perform most commonly, but not limiting, are CABG's procedures, which is bypass surgery. I also perform minimally invasive and robotic surgery for lung cancers. We do esophageal cancers as well. Recently, we have started a TAVR program in HCA Florida Broward to help patients with thoracic aneurysms and dissections. Of course, robotics is something that many surgeons institutions are doing. We have a good robotic thoracic oncology practice that's developing. We also have the ion technology for localization techniques and lung nodules. So I think technology is something that's really changing the face of cardiothoracic surgery. I want my patients to know that we serve not only the Broward area, but also surrounding communities and counties when it comes to structural heart disease, when it comes to valvular issues, when it comes to cardiomyopathies, when it comes to arrhythmias. We treat it all, okay? And we're able to take not just the bread and butter cases, but also the rare and complex cases as well. I think what drives me every day in the field of cardiothoracic surgery are the patients. Many of these patients have sort of failed conservative therapies, and now they've come to me as a last resort. I give them a shot at reliving again, and I just enjoy giving hope to my patients. That's what gets me up every day.